Hello everybody, this is Dr. Richard Shuey from Back to Health Chiropractic here in Sonora, California. And today I want to talk to you about something that I run across all the time in my practice. I'll have a patient that will come in with back pain and I ask why or what caused their back pain, and they go, nothing. All I did is bend down and tie my shoe and my back goes. And I hear that all the time. So I thought it would be nice to be able to explain why that happens. What's the mechanism that causes your back to go out like that? So we're going to look at some of the muscles of your core. We're going to look at one particular called the multifidus muscle. All right, I wanted to show you the multifidus so that you understand what I'm talking about in this video. It's this muscle that you're seeing running up here. It's really not one muscle, it's multiple muscles that actually attach from the vertebra here going down to the second vertebra, and then when they contract, it protects the joint that's found in the middle of it. Now the multifidus also has three layers. One of them will go just down one vertebra, the middle layer will go down 2 to 3 vertebra and attach, and then the outer layer can go as far as 4 vertebra down and attach. So when they're all contracting, it's really stabilizing the spine down the whole thing. You'll also notice that this only shows one side, but there is one on this side as well. Okay? Very important as well is the sacroiliac joint here. This thing is protected by this joint. This is a very important muscle that prevents sacroiliac strain sprains. So if you're suffering from that, this is a very important muscle to gain control over. Now this muscle runs right up the spine, and it's right in the back here. So how to get to it, you can do this. You're going to take your hands and put them on your hips, just like I'm doing right here. Then you're going to take your hands and you're going to slide your thumbs back until you come to the spine on both sides of it. And then what I want you to do is I want you to come just outside of that where you feel the muscles bunch up on either side of the spine. Okay? That's your multifidus muscle. Now what I want you to do, now I'm going to stand up and so you can see this. You're going to see my back again more than you're going to see my face. What I want you to do is I want you to lean forward just a little bit and then come up to a nice tall position. What do those muscles do? Can you feel it? What they're going to do is they're going to be bunching up just before you start to bend forward. I want you to feel what that feels like, in a sense, for your fingers and the muscles. And I want you to check and see, are you equal on both sides? When you start to flex forward, do the muscles contract at the same time, or does one kind of beat the other one out? Okay? All right? Now, the next thing I want you to do is I want you to walk in place, or just walk forward if you want to, and feel what those muscles do. You're going to feel one contract while the other one sort of relaxes, and then back and forth it's going to do this. Okay? That's what's going to happen. You want to look at that and see how that moves. And then I want you to do this. I want you to put your hand down to your side. Keep one hand right back on those muscles, your left one, and put your right hand down by your side. How about that? And then what I want you to do is just raise your arm up. Now you need to be up in a nice tall position where that muscle is relaxed, and then raise your arm up. What happens? You're going to feel that that muscle is contracting against you. Every time that you start to raise the arm, it comes up. Well, what that response is called the feed-forward mechanism. And what that is your brain is telling that multifidus every time that you flex forward, bend back, any movement, your brain tells your spine to contract and stabilize your back from being hurt just before you start to move. The problems that are creating where the pain is coming from is that your brain is not telling that muscle at the right moment. There's a delay in that control, and it will usually be on the same side as the back pain is. So if you get more constant pain on the right side of your back, that's going to be delayed on that side. And so for a split second, when you bend forward to tie your shoe, that joint has no protection from the muscles, and the joint gets strained. And that's what causes your back pain.